Good morning. This video we are going to cover some basic heart anatomy and then also cover some of the physiology, specifically the valves and the blood flow of the heart. And then we're going to follow that up in the next video going over the electrical system of the heart. I'm going to try to keep these videos to about 10 minutes, so that way if I have lots of 10-minute videos I'll get more page views on YouTube. So here we go. So first off, I'm going to pick a color and we're going to draw the heart out. I did this when I was in school and I recommend this to everybody when you're doing lots of questions on your tests about the heart or anything really, but draw it out. Make sure to engage all the different parts of your brain. It's a lot easier to draw it out and trace the path of the valves than to try to read a B, C, D question and try to remember which way the valves go. So here we go. Now, when you look at pictures of your heart in your anatomy textbook or your paramedic textbook, you're going to notice that the pictures look really, really fancy. I can't draw that fancy. So I always draw a Valentine's Day heart for any of my diagrams of the heart because I'm not a cardiologist. I don't do heart surgery. I don't need to have a really, really, really good diagram. So here we go. So the heart is divided into 4 chambers. And we're just going to split this into 4, nice and simple. So first chamber up here, we have the right atrium. And the atrium, that's a Latin or German or French word for up high, like an atrium in a building, something like that. So the atrium, that's like the top parts of the heart. I think that's like the right atria, the left atrium. Then the blood goes from the right atrium through a little valve here. And this valve is called the tricuspid. And tri, of course, means 3. And if you were to look at that valve under a microscope, you'd see that, or an anatomy class, you'd notice that heart valve has 3 different parts to it. So if you really wanted, you could draw it out like a little peace symbol like this. 1, 2, 3 valves. 3 parts to the one valve. The blood leaves the right atrium, goes through that tricuspid valve into the right ventricle. And then the blood leaves the right ventricle when it gets pumped out. I'm going to draw this in blue because this is deoxygenated blood. Now this doesn't mean it's 0% oxygen. It means that that blood is probably going to be somewhere between 80 to 90% oxygen. It's only deoxygenated as opposed to blood that's fresh out of the lungs. So blood goes through here, this blood vessel. Now it's carrying blood away from the heart, so that means it's an artery, and it's going to the lungs. And so anything having to do with the lungs is going to have the word pulmonary in front of it. So this is the pulmonary artery. Pulmonary means going to the lungs. Artery means it's carrying blood away from the heart. So we're going to switch over to the other side over here. So you got 2 lungs. So I'm only drawing 1 lung at a time, but you can figure it out. So now we've got blood coming from the lung again. And now it's coming back to the heart, going this direction. And this is oxygenated blood. And I'm drawing it in red because the red blood cells are chock full of oxygen. And this blood vessel, now it's a blood vessel bringing blood back to the heart. So those are all called veins. And then again, it's coming from the lungs. So you probably already guessed it. This is the pulmonary vein. So now it comes into the heart here, and this is the left atrium. And then the blood's going to go through a valve here, going down to the ventricle. And this valve, here's a picture of the valve, and there's only 2 parts to it. So this one is sometimes called the bicuspid valve, or someone got it named, it's got 2 names, this is tricky. The other name is the mitral valve. So you may see it referred to as either name. Goes through the mitral valve down here into the left ventricle. I just realized I forgot one of the valves. Sorry about that. This valve right here, leaving the right ventricle, going to the pulmonary artery, is called the pulmonic valve. Pulmonic, valve, you got it. You understand how medical terminology works. So we got the left ventricle. Now the blood's going to leave the heart. It's going to go out this way. This blood vessel is the big, huge one called the aorta. And then this valve right here is the aortic valve. And then the blood's going to go out to the body. It's going to go everywhere but the lungs, because we already got that covered. Then the blood's going to come back. It's going to come back deoxygenated up here into the right atrium. There's 2 blood vessels that carry the blood back, and these are called the Vena Cava. And you got one that brings blood from the top of the body. That's the superior Vena Cava. And then this one brings blood from the bottom of the body. And this is the inferior Vena Cava. C-A-V-A. And they bring blood back in here. So that is the very simplistic way of looking at the heart and the lungs and the body, how the blood flows all around those different parts. Now, a lot of times people have trouble remembering where the valves are. If you draw out all the different parts, that's probably going to help a lot. And there's 2 funny sayings that I was taught that might help you remember kind of where which valve is at. So one thing that you can say with regards to these 2 valves here between the atria and the ventricles is that if you always start on the right side of the heart, you try before you buy. So you go and you test drive a car, or you go on dates with a woman or a man, whatever your thing is. So you try before you buy. So that's how you remember the tricuspid valve is on the right, the bicuspid valve is on the left. The other way that some people will remember where the blood vessels are at is, oops, no idea what I just did. I hope this doesn't look terrible to everybody. The other way that people will remember the valves and which way they go is they'll remember this saying, you it's all green. It's a good thing I don't get paid to do this. Okay, so the other way that people remember the valves in order is they'll remember this saying, toilet paper my ass. So the valves, you've got the tricuspid valve, you've got the pulmonic valve down here in the bottom left, you've got the mitral valve, that's the M, and you've got the aortic valve. So you got toilet paper my ass. So maybe you shouldn't describe the valves that way if you're talking to a doctor, but we're paramedics and we will use any way of remembering that helps us remember it. So that is the basic structure of the heart. We're going to do another video right after this going over the electrical system of the heart. Thanks, I hope this was helpful.